That way I can,
You can take care of it.
I can post it later.
All right.
Okay.
I am going to see if I can make this work. I have problems because, oops, I didn't want to do that. I'm going to minimize all my screens so that I don't get lost. Okay, now I'm going to try and see your nice faces. I miss seeing people's actual faces. So just a title slide here, and we have a series of 4 presentations. We've already done one October 13th, and Jeannie, I don't know if you could post where that's located. It's on the TAP website, but
Okay,
maybe you have a link that you can put in the chat for them.
yes.
And so it was recorded, and so if you missed it and would like to see that, you can go back and take a look at that. Tonight, we're going to be talking about function-based interventions. I have this designed primarily, our understanding is that just community people, some parents, some current teachers, some practitioners, in order to just get some maybe introductory kinds of information about challenging behavior. I am really excited to get into deeper conversations with people. If you give us feedback about that, we're trying to plan more of these talks so that we can get the community involved in discussing challenging behavior. I just want you to know starting out that this is kind of some basic information. I'm excited for tonight because I feel like we can cover some fairly doable strategies to address challenging behavior. Our last webinar talked about function of behavior. So I'm always talking about interventions with an understanding that we know why the child is engaging in the problem behavior. And so that's a bit of a foundation that I like to start with, though I am going to talk about some general strategies that you could consider also. All right, I am going to move to the next slide. And Jeannie, if you could help monitor any chat that might happen, that would be really great. So feel free to ask questions in the chat, and we will try to address that, or open up your microphone also if you would rather.
You bet.
All right, this was your cue. Can everybody see my PowerPoint, by the way? And you can shake your heads. Okay, and do you see this cute little start recording now? Okay, good. So I like to start with some objectives to understand how functional assessment data gives evidence for the function of behavior. And so that was really what we tried to talk about last time. But again, I like to make sure that people are coming to some common understanding that we use assessment information in order to determine a reason why a child will engage in problem behavior. Sometimes it's a little more complicated than a single reason. There may be multiple reasons why they engage in a problem behavior. And so real life is not quite as clean as what the research might show, or how some of the books might talk about it. And so we can talk about that. But it is important to know that collecting data in order to determine a function is very important. To identify 4 types of function-based interventions. So there are a variety of different tools we can have in our pocket. Again, assuming that we know what the function is, we can address challenging behavior at different points in time. And knowing the function is going to help us know how to select from our menu of tools at any given moment. And then to learn how to match interventions to those functions is very important. Okay, my controls, I have to. So there will be a handout, and Jeannie, again, if you could just tell them where they can locate that if you're sending it out. We have the presentation, we have that in a note format, and then of course you can always come back for the recording when you need to.
I will email that to the group.
Okay.
Thank you.
Somebody else coming in. So last time we talked about 4 different functions of challenging behavior. We know children will engage in behaviors in order to obtain attention. It gets a little bit more complex than that. It's like, whose attention? So you always need to kind of understand that part of it. Sometimes children will want attention from the parent. Sometimes they'll want the parent from their teacher. Sometimes they'll want the parent, the attention from their peers. And so it's when we get into interventions, it's important to understand who they want the attention from. Also, the type of attention that they want is kind of important. And so that's where assessment comes in really, really handy as we kind of dig into that. So we have to have a true understanding of that. We know that children will engage in challenging behavior when they don't want to do something, right? So if you are presenting to them a task demand saying, oh, it's time to get dressed, or it's time to get ready for bed, or it's time to get your math book out, those are task demands, and challenging behavior may occur after that, so that the child can delay doing whatever it is that they would prefer not doing, or to delay something that they perceive to be very difficult because they don't have a lot of skills in that area. So they may engage in squawking or whining or something like that, and then they delay the inevitable of having to do that task. Sometimes they engage in the problem behavior when they're already in the task. Maybe you got them started getting ready for bed, or you got them started on their math work in a classroom, but then they engage in a problem behavior. They throw things, or they try to run away. I put avoid and escape in the same bubble, but really it's a different point in time. I remember when my son was really little and I was trying to give him baby food, and if he recognized peas, there was no way he wanted that. So he would start his challenging behavior before the peas got to his mouth. He would start shaking his head or start to squawk, and probably even, it's always harder with your own child than it is with somebody else's child. I probably removed the spoon. And what I did is I reinforced that squawking, because the thing that he didn't want went away. So he was able to avoid that particular situation. So we know there's obtain attention and avoid escape. Sometimes kids are engaging in problem behavior because they're trying to get something that they want, an activity or an object or a food item, and they're engaging in whatever that behavior is in order to get it. You see this often in a grocery store, right? So you've got kids with all this stimuli around them, and they start reaching for things, grabbing things, squawking to get things. And I am probably guilty of this when my son was very little. In order to keep him quiet, I probably gave him one of those things, right? So that he would stop squawking in the grocery store. So he was engaging in the problem behavior in order to get something. And what I ended up doing is probably giving it to him. And so he was more likely to engage in squawking when he wanted something in the future because he was paid off by it. And so that sometimes is the way that kind of plays out. It could be just like an activity, or something that they want to be doing, like swinging or bouncing or something like that too. So it's not always just an object, it could be an activity. Then we've got a function of that's related to sensory needs and input that a child is trying to get or to get away from. It could be, I've worked with lots of children on the autism spectrum where they couldn't tolerate certain types of stimuli. Maybe it was too much noise, maybe it was people are too close or people touching them, and they were trying to get away from that. On the other hand, other kids were trying to obtain things. So sometimes the flailing of the hands or the rocking is in order to get some kind of a sensory experience. So they engage in the behavior for those reasons. So we have kind of these four general areas of functions that we talk about and when we come up with different kinds of interventions. All right, go to my arrow again. So one thing that I always like to just kind of pause and say, it's really important for us to try not to change every behavior that might be a problem. It's really important for us to do some prioritizing, make sure that we have good reasons for wanting to change the behavior of a child or young adult. It's kind of a powerful position that we're in. You know, as far as us saying we need to change a behavior, often if we want to be very effective, we have to recognize that we will have to do some changing of our own behavior in order for changes to take place. Changing behavior requires a lot of planning, and I probably can't stress that enough. We really want to base it on evidence, and we want to do some planning. We need to do some changing of some different things in the environment or different cues. We need to identify, you know, things that kind of trigger the problem behavior, and then be willing to do some changing before the problem behavior occurs, and then how we react to the problem behavior. We need to teach new behavior. I teach special education majors at the University of Illinois, and on the IEP, it asks, when we have like a functional behavior assessment and a behavior intervention plan, whether the behavior or whether the problem behavior is occurring due to it being a skill deficit, like a lack of a skill, or is it more of a performance deficit where the child knows what to do but just is not doing it. Okay, I like to almost completely make, even if it's a mistake, to say that I think it's a skill deficit, that I think if we teach new behavior and new skills across many different contexts, that the child will have a larger repertoire of choices of behavior than they would have had before. So teaching new behavior is very important. I think challenging behavior is often communicative in nature, that the child is trying to say something to us. Whether they're saying it with words or with their behavior, they're still trying to get a message across. So teaching new communication behavior is really important so that they can get their needs met. And so teaching new behavior is good. And then again, understanding what our role is within challenging behavior and how we might be contributing to it. And just not pointing a finger kind of a thing, but really just trying to understand how our behavior may be contributing as a trigger to the problem behavior. This is kind of the format that I like when we're thinking about what the function is. So after we've done our assessment, we identify different events or cues or triggers within the environment that will occur. And then we have already defined very carefully what the behavior is. And then the behavior is occurring to get what result. And I've recently kind of changed my wording in this sentence because I had some teachers say, when you use the words "in order to," it makes it sound like the child intentionally is tantruming to get your attention. I don't know that there's intent, like conscious intent, but the child has learned that when that behavior occurs, a certain response is given or a certain consequence occurs after the fact, whether it's a something that they're thinking about or whether it is just is. So sometimes I like the wording "that results in." So when the child is not, or when the parent is busy doing something else, the child engages in any tantrum that results in the parent giving them attention, right? So if a child has gone for a period of time without one-on-one attention from the parent, or maybe the parent is now on the phone, or the parent is cooking, or the parent is doing laundry, something like that, When the child is not receiving that attention, they then engage in the challenging behavior of a tantrum, screaming and hollering, that results in the parent coming right back and providing them with attention, right? So this would be a hypothesis of function that the child engages in the problem behavior in order to receive the parent's attention. Now I can do something with that. If I know that the child is engaging in the behavior with the desire of getting attention, now I can start thinking about different interventions related to attention. And that narrows things down considerably for me. So I'm not just randomly pulling interventions out of the air, trial and error. You know, I have a better opportunity, better success rate if I'm choosing an intervention that's related to an attention-seeking behavior. So one of the things that I've discovered over time is that there are just some good things for everybody, right? That all children are going to respond much better. And to be honest, adults will too. So, and I have some references on one of the slides later on, you know, that are full references, but this is a really fabulous resource. And I didn't get a picture of it, but the reference is there if anybody wants more information about it. And it's for families. So this one is actually for families. They have another version for teachers. They have, I believe, another version for administrators of schools, that kind of a thing. So it's a really nice resource, and it's very easy to read through and find some really helpful information. But they talk about kind of these 4 general interventions that are just a good idea all the time, you know, when we're working with children or other people. So we need to provide frequent positive attention. And they even give us a little formula that for every one criticism or correction that we might do with a child, that we are going to go out of our way to be very encouraging 5 times, right? So if you kind of keep that in mind, you're going to always be heavy on the side of encouragement and positive interactions with the child. If we play too much with that ratio, what we have is a very negative situation going on, and it makes it even more difficult to kind of climb out of that hole that we've kind of created. And all of us kind of do this without thinking, and so putting some planning into it. You know, you might even do some self-monitoring of your own behavior with your students or with your children, in order to just really figure out, how often am I very positive? How often do I notice something really positive about that child and comment to them about that? Chelsea may remember this in class. It's kind of a catching them being good phenomenon, right? So, but we have to be conscious about it, because it's the squeaky wheel that gets our attention, right? And often the squeaky wheel is not an appropriate behavior. And then we end up responding to a problem behavior. So really being very conscious about scheduling some positive attention, really noticing when children are doing what they're supposed to be doing. Establishing and maintaining predictable daily schedules. All of us probably function much better when we have a schedule. There's a variety of ways for us to put ourselves on a schedule. I have a calendar on my email. I'm on my email way too much, right, in my life, but I'm on it enough that that's where my schedule is. And so that's where I schedule meetings. That's where I schedule appointments to the doctor. That's where I schedule, you know, almost everything. And being on Zoom most of my life now, you know, I'm just at the computer more often. So that is probably better for me. My husband, I think, prefers the calendar that's hung up by the stove. And he says, now remember, you know, we got this on the calendar. And I go, that's not my calendar. You know, like, I don't know what's on that calendar. And so, so I'm probably going to have a little challenging behavior when he reminds me something was on the calendar, but it wasn't on my calendar. So I have to be a little bit better about that. But having something that is predictable for the child on a day-to-day basis is really important. Not always the easiest thing to do when, you know, you've got a life that's changing all the time and you've got a lot of people that you have to manage, and there's always a schedule for every single person. Um, but it really does help minimize challenging behavior by having predictability. Now, there is a problem with some individuals who are so rigid that once you set a predictable schedule, that they don't tolerate any kind of change to that schedule. And so you'll see in my notes that you need to build in some variation. So, you know, you have to every few days have a slight change within that schedule in order to build in some flexibility within that person. And I think we forget to do that sometimes, especially for those individuals that are very, very rigid and very inflexible the way they think about things. I think it's important for us to build that in. I often, maybe I even told this story at the last webinar, but I did a presentation once, and there were lots of parents at this training. And when I was finished presenting, and it was about, you know, assessing for problem behavior and then giving them some strategies, one of them raised their hand and said, "So what do you do with the child that makes us get up every Saturday morning and get dressed and do all of our normal routine and get in the car and go to the school building, and we have to walk right up to the school building door, and then the child has to see that the door is locked. Once that happens, then we can all go home and have Saturday. But everything has to be the same way. Otherwise, we have all a very bad day if we don't do it that way." And so there is an extreme example of inflexible, you know, that child is not very flexible. But it also is showing that the parents have kind of allowed that to happen in order to have a life, right? So I'm not criticizing that happened. And one of the things that, you know, I said there isn't an easy answer to that, because what I will tell you is that in order to change that very inflexible person, you're going to go through a couple storms, you know, in order to kind of get over that. And but doing it as early as possible by building it into your predictable schedule, that there are some things that are going to change occasionally, maybe once a week. You know, they find out 15 minutes before that something on the schedule has changed. And then you're going to have some little bursts of problem behavior perhaps, but you're going to do it in a very systematic way. You're going to increase kind of the different kinds of variation over time, in order to build in that flexibility. It doesn't mean you should throw out a predictable schedule, because that is one of the strategies that works for most of us, is to have a predictable schedule. But we also, you and I are adaptive enough that when there's a change in our schedule, we won't like it, but we won't engage in a big tantrum about it, right? We'll just go, yeah, I don't really like that very much, but I can still go on with my life. And so if we can kind of build in a little variation to the schedules periodically and gradually, and we're going to also be teaching some flexibility for individuals. Include consistent patterns of activities. So this is like, now we have a schedule. Is there any kind of a pattern within the activities within our schedule? So when it's at home, there's maybe a bedroom, going to bed routine, right? And you know, at our house when my son was little, it was, you know, the first thing he would have to do is to probably go take his bath. And then he would have to brush his teeth, and then he would have to, you know, and there was dressing in there, undressing and dressing within that. There's some toileting things going on in there. And I would do it in a very similar sequence every single time, so that he could predict what was happening even within a task. How I taught him to brush his teeth was consistent. It's important between, you know, married people, right? To be teaching it the same way so the child is not getting confused. That would be true in a classroom, that, you know, a teacher should have a consistent way how something is being taught, the sequence of steps, so that a child is not going to get confused by having different people teach in a different way. So that's what I mean by consistent patterns, is having consistent, kind of rules, consistent steps, and that the people, all the people that are involved with that child they're all going to be doing it in a very similar way. So that that child is able to predict what's going to be happening and not have a change. So changing how you brush your teeth, by saying, oh, you don't have to do that step, is going to kind of throw them, just like if you were to change something in their big schedule. So it's kind of removing that predictability for them. All right, and of course you might have to build in a little bit of variation. So one of the examples that I remember when I was teaching my child is that different kinds of toothpaste have different kinds of ways of accessing the toothpaste, right? There are flip tops, and there's, the squeeze, there's the screw top. Sometimes you can just, I don't know if I've ever saw one where you just put the toothbrush underneath and it gives you the toothpaste, but they do that with soap. I think we're having a storm, so if you're hearing something, it's rain against my window there. So building in maybe some variation that will be typical to just somebody's life, different materials, perhaps different color toothbrush, different cup that you might be using. That would be the kind of variation that you might use. And then it's really important to define behavioral expectations, to make it really clear. So how the child is supposed to be behaving, but also to let them know how they're not supposed to be behaving, right? I don't like to stress on the inappropriate behavior, but it's important for them to be able to learn how to discriminate what is appropriate and what is not appropriate. So, so that's what I mean by defining behavioral expectations: the expected and the unexpected, inappropriate and appropriate. And then again, it's really important for everybody to be kind of agreeing on that, because if you have lots of different people involved, whether in a classroom or in a home, and everybody has different rules and different expectation, that's going to make it really difficult for the child to know how they're supposed to behave. All right. And Liz, I see that your microphone is, you're not muted, and I don't know if you need it. If you want to ask a question, you feel free to do that. And I'm sorry that there's extra noise on my end too. All right. So there are kind of 4 different types of interventions that I want to talk about. And one has to do with setting events. So we've all had a bad day that maybe started with waking up late. Now we're out of our sequence, right? Out of our schedule. Or we didn't have the Pop-Tarts we wanted. We looked in our cupboard and there weren't any. That's what my son always liked to eat, is Pop-Tarts. And so if there wasn't a Pop-Tart, then he had to come up with a different option for his breakfast. And so that might have been a little bit different situation. Maybe what happened is I was going to ride the bus to work, but I missed it, right? And so now I'm a little out of sorts because now I got to figure out a different way to get to work, right? Or maybe I was making breakfast and I spilled all over my top, and now I have to go and change that. And now I'm a little behind on my schedule because now that's happened. Maybe I had an argument with my husband and I'm like feeling really bad about that. Maybe I'm feeling a little angry because I had an argument with my husband. And now I'm going to work, and Jeannie and I are having a meeting, and I snap at her because she says something to me. And it really wasn't what Jeannie said. It was because I'm still feeling angry because of that argument I had with my husband. And I apologize, Jeannie, if I snapped at you. But those are the kinds of things that make you behave differently than how you would typically behave. And that there would be, Jeannie says something to me, and on a normal day, that wouldn't bother me. But because I'm already a little upset, something she says kind of rubbed me the wrong way, and then I kind of reacted to it. Is that kind of, people are getting it, that there can be things. Another example is you're not feeling well, that you have allergies, and it's a really bad allergy day. And then you get to work and somebody decides that it's your job to take care of all their problems, right? And on a good day, you don't mind taking care of everybody's problems and kind of helping them out. You actually enjoy doing that. But on the day that you're not feeling very well, you really don't want to handle other people's problems, right? And so you're going to react to it in a slightly different way. So one of the things that we can do is try to understand what might be different. I've known lots of kids on the autism spectrum who have sleeping issues, so they're not sleeping very well. What I also have learned is that if children have sleeping problems, parents have sleeping problems, right? And so now we've got a double setting event going on where a parent has not gotten the sleep that they needed, the child didn't get the sleep that they needed, and things are kind of volatile because of that. That's kind of a major thing. And now we're going to send that child to school, after being very, very tired and things like that. One of the things we can do is try to really communicate with the people that are with that child. So I really encourage teachers to communicate with parents, find a really good way that parents are okay with the communication. Parents communicate with teachers and say, you know what, we had kind of a rough morning. And I encourage teachers then to try to tease that out. So what do you mean a rough time? That there was a change in the schedule, or the child didn't get their medication on time, or they didn't sleep very well. Those are all really key things and can be very helpful for a teacher to know those things. So it's important for a teacher to be able to ask those things, and for a parent and a teacher to have that kind of understanding. If it's you work in a school and you don't have the children all the time, like full time, you talking to other professionals in that environment can sometimes help you identify some setting events. Sometimes children are having arguments with their peers in the hallway, and they come in and they're upset about that. And everything is going to be different when somebody comes in a different emotional state. And so kind of thinking about that. So for setting event interventions is kind of knowing what they are is probably the biggest challenge in trying to navigate and how to figure out and identify what kinds of problems are occurring, what had happened, and why the child might be reacting in a different way. So we consider that, and then what can we do about it? What are the different kinds of things that we can do to kind of minimize the problems because of what happened, because I missed the bus, because I had an argument with my husband or something like that. What can I do to get kind of back into a state of mind that I'm not going to react strongly to other things that are happening in my day? So this is just a couple of lists of, possibilities, and we already talked through some of those. Some of them are kind of teacher-ish, like in a classroom, but it could be that somebody's experiencing pain, they have sleep disturbances, allergies, infections, constipation. All those kinds of things could affect how somebody might be reacting to just a simple request, to pick up their clothing, right? Or to come to the table or something. They might react differently depending on how they're feeling. So that just gives you a few examples. So some things that, I have found that there are kind of some categories of things that we can do. If we know what it is, we can try to minimize or eliminate it. So if somebody is, bleeding, we're going to treat them, right? We're going to, like clean the wound and maybe, put some antiseptic on it, and maybe that'll take away some of the pain. We might give them an Advil or a Tylenol. If they have a headache, we're going to try and treat the symptoms or try to remove the problem, right? We're going to minimize it, make it feel as good as we can make it feel. We're going to eliminate the problem. Okay. If somebody is really, really tired, and we may just give them a rest, or we might give them frequent breaks throughout the day because we know in advance that they didn't get the rest that they needed. Okay. If it becomes an ongoing problem, then it's a kind of a different issue where, you might get teachers and parents talking and trying to get some suggestions on how to get more sleep for that child. But I think that becomes like maybe more of a medical issue as opposed to a behavioral issue to take care of. We have to kind of figure those things out. So you're going to minimize or eliminate whatever it is that setting event is if we can. We might want to do things to neutralize it. So I am upset. I'm really upset, but maybe if Jeannie offers me a coffee, a latte, please, that's what I like best. And we just sit for 5 minutes before we start a meeting and just kind of talk about what's bothering me, right? Let's just something in between that, or maybe she's going to show me some of the great resources that now are available in the TAPA resource room, and she's very excited about it, and that's kind of contagious. But there'd be no demands on me at that point. It's kind of like, it's going to be a kind of an in-between activity to help me start to feel a little bit better and more normal and not feel so angry, right? So I'm going to try and neutralize it in some way. Give me something that I really like my coffee, give me some time to just kind of talk about the weather, talk about something else, and then delay any kind of a demand on me for just a little while. And so that can be helpful. Provide some additional supports, information, cues. So inform, like it's a change in the schedule, inform the person of something new that's going to be happening, and really figure out when is the good time to do that. And I have seen kids that are the whole spectrum, that some of them you don't want to tell them until the minute before, and then some of them need some time to adjust to the idea because they have a really hard time transitioning very quickly. And so you might need to give them a little extra time. I had a student teacher at Thomas Paine, in fact, many years ago, and I arrived one day and my student teacher said, we're going to have a fire drill, which is a totally different thing than what this child is going to expect. But I have learned that if I write a note to the child, because he can read, and say, there's a change in the schedule, we're going to have a fire drill, that he will be okay. And I said, well, what a great thing that you have learned. And I said, and have you done it yet? She goes, no, I'm going to go do it right now. And the alarm went off. Okay. So it was a really great idea. And she had some evidence that it was working, at other times. And she was so excited to tell me that she didn't implement it. Well, you can probably guess what happened. The child had a big meltdown because this was not what the child expected. I went another day and she did show me that it did work though. So he was a child that needed a few minutes notice before something happened in order to be able to adjust to it. And so, that sometimes can help, just giving people some information. If I know somebody's coming in, they're extra tired, maybe they haven't felt well, they're coming from being ill, and I'm probably going to provide them more assistance than I normally would. I'm going to, not force it on them, but I'm going to be available to make sure that I can guide them through the teeth brushing, as opposed to just sending them off to do it by themselves, right? I'm going to be available. I'm going to be closer, thinking that maybe things are not as normal, and that one little frustration of dropping the toothpaste into the sink is going to blow them up, right? And so maybe just being a little bit closer and giving a little more guidance in that situation will help. Provide maybe more frequent reminders of what's expected. Oh, I know we're going to have a great day. Let's all remember that. Because again, when you're in a different emotional state, or if you're not feeling well, it's pretty easy to forget those things. And so making sure that we're just being very proactive about it. Provide a menu of behavioral choices. So when I feel sad, I really like to talk to my really best friend. When I'm feeling really anxious about something, I can go and check the schedule, or I can ask the teacher if there are any changes today, right? So I can actually provide and teach the child what some choices are when they might be feeling different ways, or they've had different kinds of events happen to them on a particular day. And I'm also going to really reinforce them much more frequently than I would on a typical day. I'm just going to really catch them doing appropriate things much more frequently and just make it much richer for them, knowing that I kind of look at it as it's a more difficult day for them. It's just going to be a difficult day because of some things that happened that were beyond my control and beyond their control. And so I'm when I'm talking to teachers, I say, you know what, it's my plan B day. And I'm just going to make sure that I'm going to do things in a slightly different way. And changing how often I encourage them and reinforce them and give them really preferred things periodically, I'm going to increase that. I'm also going to be using things to reward them that are probably the highest of the high, right? I was telling my teachers on Monday night, my teacher prep people, that it's important to do kind of preference assessments, but not necessarily use the top of the top. If the ones in the middle work, let's use them on a day-to-day basis. And then when you have a plan B day, let's pull the big ones, the big guns, right? Let's the very, very top preferences in order to just kind of help them through getting through that particular day when things are different. So using the higher preferred reinforcers or rewards and doing it more frequently is going to be a way to kind of get people out of a situation that was kind of beyond their control. And then kind of last, as kind of a category of things, is just being really much more positive, having some shared experiences that are really fun. So building in more fun things into the day or into the classroom on those kinds of days. I always say children need to have shared positive experiences with the adults in their lives. And so just building that in so that when they are having a rough day, they are more likely to respond to you in a positive way because they have associated you with really fun, positive shared experiences. And I think that, I think it's really hard for teachers and other professionals to have the time just to sit and play or sit and do something fun with their students. I think we get kind of bogged down, but I think it's well worth it because when you are having a really, really tough time, it's going to pay off during those times. And so just promoting those very positive interactions and creating a really good history and a good relationship with the student. And that's what I think that's about. And then you can also, if there are peers around or siblings, and if the child really prefers one person over another, to allow them when they're having a rough time to spend some time with that person. So setting events. So that's like things that are happening in our lives and we can't control them, but then what can we do? I like to know that I have some things I can do, that it's not beyond my control, and I can change things, to benefit that child that day.
Cheryl,
Yes.
we have a question in the chat, and Michelle,
Excellent.
maybe you can pop out on and tell Cheryl to what you were referring. But it said, could this lead to undesired dependency, such as my child fights doing homework, so I help him by writing for him or running the computer, so then that becomes the norm. I think that was addressing kind of lightening the burden or lightening the.
And I think that's where we're getting at, maybe more of an antecedent intervention, something that you are asking him, let's see, to do his homework, but he didn't want to do his homework, right? So that's more of an immediate thing. And we're going to talk about that in just a second, with antecedent.
The more you talked, I thought this isn't that same sort of, this is what you were talking about is something went wrong.
Yes.
Not a normal thing. And
Yeah.
then we do, okay.
And then those things then cause even more problems for when you say time to do your homework. Right? Like like you might struggle, like with that, or no, I don't want to do it. And there's probably a delay of 5 minutes and then he gets to work, right? But if he hasn't had any sleep,
right,
he's going to fight you tooth and nail for a very long time, right? So that's the difference between there being a setting event or some kind of something that happened that was different that day than just your normal struggle with him. And now we're going to talk about what to do with the normal struggle.
Okay, I'm waiting for that one.
All right. And I need to look at what my time is. When I'm in full screen, I can't even see it. So, oh, I better hurry along, shouldn't I? Okay. I'm kind of long-winded. So antecedent, that would be then things that happen right before the problem behavior, like the delaying the homework, right? So offering some choices, that might be something you can do and say, do you want to do your homework at the table, or would you like to do it in the living room? Would you like to use markers, or would you like to use the whiteboard, right? So you can give some choices, even though he still has to do his homework. Could you give some choices? Would you like dad to help you, or would you like to have mom help you tonight? You know, that kind of a thing. Choice is really powerful, and there's a lot of research that supports it. So trying to give some choices. So if he has two different kinds of homework, which one does he want to do first? That would be, so really trying to examine how many choices we give children. And when you think about how many choices they actually had during their schooling, and I don't know what it's like for everybody now, that a lot of it's virtual, but I do think that that children may not have as many choices as we think they have. We have hundreds of choices, and we make decisions every, like every minute, but I'm not sure that children perceive that they have a lot of choices. And so it's a pretty powerful thing. The other thing is interspersing or alternating difficult with easy. Okay, well, we're going to do 5 of these math problems, and then we get to do, right? And then it's going to be like a 5-minute fun thing that they can do. And then you can go back to the more difficult thing. So that makes it feel like it's not such a drag if you can kind of alternate things. Preferences we kind of talked about, where I like with teachers, if they know what the interests of their students are and they're doing like word problems for math, they can embed in different things that are related to that. Last year I had a student teacher, and she was saying, I'm having really trouble getting this young lady in high school to just participate in the activity, the math activity that I'm teaching. And I said, well, what is she like? Oh, she's a fashionista, and she likes, to do her hair and nails. And I go, well, why don't you just do word problems that have to do with buying makeup and things like that? And so she went right out and did it. And it was funny because the student was a really smart student. And she goes, you wrote this, didn't you? Like it didn't come from a book. She just knew. And then my student teacher says, yeah, I did. She goes, this is more fun, and then she went ahead and she did the work. So, embedding different kinds of preferences can be really helpful. Predictability, we've talked about. Using timers to kind of cue people is going to be really helpful for an antecedent, like before the problem behavior occurs. You might rearrange things. You might have them do things in different locations, depending on what works better, and just kind of figure out some of that. Being explicit about what is expected is probably one of the best antecedent interventions, is making sure that everything is really clear. I have a student right now that I meet with often, and I think it's very difficult for the student to move forward if there's any confusion at all on what she's supposed to do. And I've just found, this is a college student, a very bright college student, but I've found that one of the things is that she just stops, and she's not able to move forward unless the expectations are crystal clear. And it's more than just getting it in writing. This is a student that actually needs it auditory, along with, and then also some modeling. Actually requires some modeling and some examples in order for it to work. And so, it even happens at the college level. So, all right. Did that help with that previous question on some things you could do with the homework? All right. I think I actually have another slide on this. You can reduce distractions. You can give some signals when things are going to change. Sometimes you can give some scripted stories, right? Social stories, in order when there's going to be a very difficult situation, to kind of provide information about the situation so the child can start thinking about choices of behavioral choices on, if I behave this way, this is, you know, what people will think, or this is what will happen. And if I behave this way, other things will happen, right? And so it sometimes that can be really helpful. We can reduce the difficulty. So maybe your child is having trouble because there are 20 math problems, and you might say, well, let's just do 5. Let's do 5, and then we can do some of your reading, and then we'll come back and do maybe 2 more, you know, like to kind of break it up a little bit. Behavioral momentum, I've actually just seen this recently in some ABA clinics. It's often it just looks like they're trying to get the child to imitate, but once the child already knows how to imitate, I know that that's not their purpose for it anymore. They actually get the child, these are really young children for the most part, to respond to very easy tasks. And so clap your hands, stomp your feet, touch your head. Okay, put this block on top of this other block. And it's the block on top of the other block is the thing that the child wasn't wanting to do. But if you do this, what we call the behavioral momentum, and do some easy things, yes, you did it. Another easy thing, yes, you did it. Do the easy thing, and then you ask them to do the more difficult thing, they're more likely to do it. There's research that proves this, that it's kind of this comply, 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 comply. If you give them an initial difficult thing and they refuse, you are now in a pattern of refusing. But if you start them accepting, they're more likely to accept even a more difficult task. And we call that behavioral momentum. You can look it up. There's other fancy names for it, but that one's probably the easier one. And then we have all kinds of visual supports. And please come over to the resource room when we're open and just see all the different kinds of visual supports that you can use in order to help clarify and make things very clear for a child so they know when something is going to happen and how to do something. There's just all kinds of really wonderful visual supports that you can use. And this is not what this presentation is about, but I would love to just talk about visual supports. Teaching new behaviors. And I'm just going to really stress teaching ways for the child to communicate, and the communication message that they give you will get the same result as their problem behavior. So that's what we call functional communication training, or replacement behavior. So, so your child doesn't want to do their work. And it would be much preferable if they would say, I don't want to do this, or I want to do this in 5 minutes, not right now, than for them to slug you in the face, right? I mean, everybody's going to agree with that. Ultimately, you still want them to do the work, but there's a series of different things that we can do. We want to give them some power because they feel like they have none. And so we're going to give them the power with a new behavior. The behavior works. And then I could talk to you for a long time about building kind of a tolerance for them to stay in the task longer and longer and longer, or waiting, you know, getting a break, but not getting so many breaks, right? And so it's kind of getting them to tolerate the task a little bit more. If it's just,
Cheryl,
yes.
we have a question, and it is 6:57.
Okay. All right.
So if it's all right.
Yes.
My daughter has never liked timers or warnings. She is now 7, so she has articulated to me that timers make her very anxious. So now I tell her the moment of the transition. I also do not tell her in advance about her doctor's appointment because she'll worry continuously. She is a very negative and worrier. Any ideas?
So with the timer, I've actually seen really great where somebody will say, we are going to switch in just a second. And then what happens is they'll go 3, 2, 1, all finished. And so maybe, you know, kind of an immediate thing, and maybe build up to a timer, but maybe doing something to do with time and then kind of building on that. 5, 4, 3, 2, 1. I've even seen kids where they like to watch that, like on a visual, you know, counting down, but maybe just auditory, or maybe using your fingers or something like that might help with that. Being really anxious and kind of regurgitating it over and over again. right? And working themselves up when a change is going to be happening. I think you have a good strategy of waiting until closer to the time when it's happening, and then giving the information. Is it a big problem then to get them to move on? Is that what the issue is?
No, it's just, hi, this is Irene Dueñas. It's just that it just goes contrary to like all the trainings that I've had. So I was wondering if that was okay.
Oh, absolutely, absolutely. There's the whole spectrum of people. So some people want to know a day in advance. And other people, like this little guy with the message, if you give him a written message like the minute before it happens, he's absolutely fine. If he doesn't get a message, he blows up, right? But he does need the signal, and then you just have to adjust when you get the signal of when there's going to be a change. And I think that that's fantastic. Yep. Hopefully I answered that question right. I am going to leave this, and I know we're probably at the end. I just want you to know what else is here, and the handout will be given to you. Reinforcement. We want to make sure that when they're doing things that they're supposed to be doing, that we're going to catch them doing that. And then, of course, when they're engaging in a replacement behavior, we have to honor that. So if somebody is saying, I need help, Mom, that is a much better way than having a tantrum. And so then we want to deliver the help with that person, right? There are other interventions to kind of delay the help or to teach them how to do it themselves, because they need to learn how to not always ask for help, that they need to do it if they know how to do it. And if they don't know how to do it, then they can ask for help. That's a whole nother longer conversation. But I want you to know that I understand that there would be a little bit more complex. Really important not to reinforce the problem behavior. So we call that extinction. Not very easy to do. So if it's like an attention behavior, we want to make sure that we are giving a lower quality attention. You know, if we need to protect people, we need to protect people. And so we have to give some attention, but we don't have to give high quality, like wonderful, top of the line attention when that happens. And so we want to really minimize any behaviors getting the reinforcement, like if it's for attention, we're not giving them very good attention. All right, and sensory is a little more tricky, and we could probably just do a presentation just for some of the kids that engage in some sensory behaviors on things to do, but giving them lots of opportunities to engage and to learn how to do activities that will give them sensory input would be really important. If they are sensitive to sensory input, then giving them ways to mask it, put headphones on, being able to excuse themselves from a loud or crowded situation, maybe to be able to express what they do prefer instead. So that can be really helpful with communication. And I just had kind of some examples, and I just kind of filled in, if somebody is doing something to escape, what you could do for a setting event. You can provide them with a new schedule if there's a change. You can do some signals. You can break down the task. So things that we've already talked about, but I put it in a chart for you to kind of take a look at. And that will be in your notes. And I lost my little arrow thing. I know I'm going over. This was just another example of when a child is busy, and we kind of talked about that already, what you could do instead. And then I have just an empty chart, so it might be helpful for you to kind of think through that with your own situations. Thinking always what our role is in the occurrence of challenging behavior is important. It's really hard for us to see our own children in distress. It's really hard to follow through and be consistent. But to understand what our role is really going to be helpful, I think. And I will stop, and I'm willing to hang on for a little bit if people are willing to stay, but I don't want to keep you too much longer. We do have another session. What is the date? On December 16th. And we'll talk a little bit more about the tools. And I really want that to be more of people bringing kind of situations to me, and then us to talk together about how to solve some of those issues. And I think that'll be me, not so much talking, but getting other people talking and doing some problem solving together. I think that would be really exciting to do some problem solving. Thank you so much for coming. Nice seeing you, Chelsea.
Thank you, Cheryl. That was so helpful. Like we said, we're willing to stick around if anyone has any questions that they'd like to ask. If not, please be dismissed and enjoy your evening. We appreciate the time that you spent with us. And again, Cheryl, so helpful.
Thank you.
I wouldn't mind talking
All
to
right,
you a little.
that's fine. And
Um,
unless there's something on my slides you want, I'm just gonna stop sharing and then I can see your face.
I have two autistic boys. One is 12 and one is 9. And I would say my biggest concern right now, my youngest is in ABA therapy, and that is going well for him. He had some behavior issues at school. And our oldest, and that was last year. ABA therapy started in August. School is going well. Actually, we do remote learning. I guess they call it hybrid here, where he goes 2 days. Well, he's actually going 3 days a week, and then it's 2 days at home. So it's working out well for him. My oldest, who always did well at school, is struggling more this year, but it's at home. He's always kept his challenging behaviors at home, but they flared up a lot this year. And I think it's that whole distinction. He's always been my more rigid child.
Mhm.
School is school, home is home.
And now it's all mixed up, isn't it? It's all mixed
Yeah,
up.
absolutely.
Yeah.
He said, I would just rather be at school. And I talked to the team. He does not have an IEP. He has a 504. He just didn't qualify because his diagnosis wasn't interfering enough at school to warrant an IEP. But
so he's falling through the cracks a bit because of that.
absolutely, because, and case in point, at our last teams meeting, basically the quarter, all the teachers accepted all of his homework, even though it was very late. So he got A's and B's. If they had not done that, he would have failed. Well, they were going to start a program where on the days where they wouldn't be in school, that kids that needed it could come and sit in the library and work on their schoolwork. And the principal said, well, that's reserved for kids that are failing 2 or more classes. And I'm like, well, I guess we wait another semester and fail him 2 classes. It's like, and I understand where they're coming from, but it's not helpful.
Yeah, and it seems like it would have been a very non-costly accommodation, right? I mean, it just seemed like it would have been an okay thing, but it's almost like the system was too inflexible, right?
Right, and I'm going to keep it in their minds, because at this point it hasn't even been approved for anybody.
Mhm.
But I've made it very clear that, this is something that's going to help us. And I mean, but we still need to work on what goes on at home, because we definitely have that. We sit down to do homework and it's almost an instantaneous blow up. And of course, I have negatively reinforced it. And so we both need to, I need to change how I react to things. But we're definitely in that point of, when I don't react to it, then he keeps upping the ante, and so.
Until you have to react.
Right, exactly, absolutely, yes. And so.
And that's a very predictable thing, and it's a very difficult thing. I mean, it's really hard because he pushes all your buttons and he knows exactly which ones to push.
Right,
So,
and he's 12 now, and he thinks he's grown up, and so I think, we're dealing with a lot of stuff going on, but.
So does he respond well on the computer? Does he learn pretty well on the computer, or is it just a real distraction to him?
Well, he has, they've diagnosed him with ADHD as well. I'm not 100%, to me, my younger one has it, he definitely has the hyperactivity, he bounces off the walls. Now my older one is more like, he gets a little spacey if he doesn't really care about what's going on. So, I mean, so I think because schoolwork's not very engaging to him, he's very smart, but he doesn't really care about getting good grades or turning in his homework, or, those aren't motivators for him. So
What is a motivator for him? What does he like?
playing with his friends on his computer. He loves video games. That's his big thing. And he'll call his friends on his phone, and then they sit and play video games together. So that what I would say would be his, or with his dad. Like tonight, well, he's doing karate. That's something we had him do that he doesn't have to be on a screen for. But and tonight he wanted to be able to play with his dad on computer, so on Minecraft. So so I would say those are definite motivators. He likes candy. Obviously, you don't want to reward everything with a piece of candy, but and he likes to play. He does enjoy board games. They happen to be the ones that last for hours, like Monopoly or Risk, or nothing real super quick that you could play.
Well, then he would have to, if you were to use that like systematically with him, he would have to accept a 15-minute time at the board, and then that would have to be a continuous game that goes on for months.
Right.
If I could interject, please, if it's all right. Going back to one of Cheryl's first comments about, it's good to assume that a behavior is there because of a deficit. And I'm wondering if you've had his executive function skills assessed, because that diagnosis of ADHD, ADHD is a disorder of executive functioning. And from what you're talking about as far as late assignments and, that motivation is a chemical state in your brain. And if your brain isn't creating the chemicals to motivate to initiate a task, that's not willful. That's something that's going on within the brain chemistry. And so, we at TAP have executive function groups that he would definitely qualify for, but I wonder if addressing the underlying executive function deficit, or having that at least assessed or ruled out, would be.
Okay. So we had him, I'm sorry, we had him, he received his diagnosis from Easter Seals in Peoria, or actually we might have went to Burlington, or I think we went to Bloomington Normal with him. And they did talk about his executive function. He was, I want to say he was nine. Our youngest was diagnosed first, but we knew as soon as he received his diagnosis that our oldest was too.